Hi, my name is Kristen Keller. I am a career counselor here at San Jose State University, and today I'm going to be taking you through a workshop called Career Exploration for San Jose State undeclared pre-nursing students. This is a requirement in the spring of 2019, and I look forward to taking you through this exploration process. Today's agenda includes an overview of UPN admission statistics at San Jose State, the various paths to a nursing career, alternative majors, many of which are available here at San Jose State. We'll be sharing some sample health careers and salaries to give you some ideas of paths that you might take. And then we'll move into understanding your Focus 2 results, as well as what you can do with this information and how to go from here. The workshop will be wrapped up with an overview by AARS to help you understand your next steps regarding the academic advising process. People are attracted to nursing for a lot of different reasons. Take a quick minute and think about what originally attracted you to this field. The most common things that we hear from students are often they have a family member who did this, maybe they had a health situation growing up and a nurse was really vital to them or their loved member getting through it. Other reasons are stable careers, making good money, and just wanting to help and care for people. One of my favorite ways to facilitate career exploration with students is to encourage them to check out videos, often titled Day in the Life. This is a great way to really understand what a typical day or typical duties are like associated with certain careers.
Nursing in a nutshell is compassion, reprioritizing, constant things changing. It's fast-paced, it's fun. You meet a lot of people and you get to be a team player and make people feel better. My mom was a nurse, and when I watched her come home from work so satisfied, it made me think I really wanted to do that as well. So the reason that I chose nursing was because you spend your days caring for other people. You feel good at the end of the day, even though you're exhausted, you know. The positive aspects of nursing are great hours. You can do 3/12s a week. You know, it's great if you want a family. That's one of the reasons I chose it. The job itself is so satisfying. I can't say that enough. You feel great at the end of the day, and all day long, you know, you're not sitting at a desk. It's not boring. It's so busy, and there's lots to do and lots to learn, and you meet a ton of people. Well, there are a few negative aspects of nursing as well. I would say some are just the stress and the busyness. You got to reprioritize. So if you like to set goals and stick to it, you know, check through the list, that's probably, you have to learn differently, you know. And it can be really sad depending on what you go through. You know, it is sickness, it is dying. It can be really difficult. I think some of the main skills needed for nurses would be compassion, number one. Really caring about people and trying to understand what it's like being sick or having a family member that's dying. And just being there to really help and bring hope and uplift them. When I decided to do nursing, I just worked really hard in school. Sciences are really important, of course. It's good to just practice your social skills as well, you know, try to empathize with other people, imagine what it's like being a patient in the family and start, you know, just thinking, getting yourself in that mindset and caring for others. I think going into nursing would be a great financial decision. You can provide for family, you can enjoy life, not have to worry as much about finances. It's a fantastic profession, but you gotta work hard. You really work hard to get into it. It's more competitive nowadays than it used to be, so just prepare, and don't give up. Keep reapplying if you have to, but you won't regret it.
So it probably isn't surprising to you that it is very competitive to get into the San Jose State BSN program. So let's look at exactly how competitive it is. So on average, 200 to 300 apply to the San Jose State program each fall. About 150 to 200 apply in the spring, and the average number that get in is only about 60 per semester. In 2018, the average T-score for a student who was accepted into the San Jose State's nursing program was 88%, and the average GPA was anywhere between 3.7 and 3.8. Keep in mind that these statistics change every semester, and actually my understanding is for the last cohort that was accepted, the T-score was a bit higher, and so was the GPA. The whole purpose of this slide is to start getting you familiar with some of the different nursing terminology and roles. I want to start by helping you understand that if you do get into the San Jose State Bachelor of Science in Nursing program, you would finish your degree, you would go on to take and hopefully pass the NCLEX, and at that time you would be eligible for an RN role. You can see that if you continue your education beyond that, you can move into nurse practitioner as well as APRN roles. And this is something that's really common throughout nursing, is you really do need to be dedicated to wanting to continue your education and keeping your education and knowledge fresh. So the following roles on this slide fall below the RN level. And we did find that while doing the workshops, a number of the students in the room had already started volunteering or maybe even were working towards some of the roles on this page. And we share this, again, just to get you familiar with terminology, but also to start understanding the different duties that each of these roles have, different levels of education required to earn them, and if you are in a program, how long it will take you to get there. So one of the big things that we hope you walk away understanding today is that there are a number of different ways or paths to get into the nursing field. Many of you may have just assumed you would be on this blue path, which means you would be accepted into the San Jose State Nursing Program, go on to graduate with your Bachelor's of Science in Nursing, pass the NCLEX, and then get hired and work as an RN. The reality is, now that you understand the competitiveness, that you may need to consider these other two paths, and we'll be exploring both in the workshop today. Let's start with the fuchsia side. So let's just say that you are not accepted into the San Jose State nursing programs. We're going to be talking with you over the next few minutes about how we're going to encourage you to explore other careers and majors available at San Jose State. There's a lot of related majors that actually work in hospitals and work directly with patients in medical settings. So many people actually choose a different major, let's just say public health. They go on to graduate with that related major, and then they're able to go into an alternative career that's very related to nursing. The other option that we'll be talking today is, let's just say you go back a step, you graduated with a related major, let's say for this time it's social work or even psychology. Oftentimes you can then move over into this pink side, which is a program called an Accelerated Bachelor's in Science in Nursing. This is a really unique program that we'll talk about further in a moment, which allows you to go on and get a second bachelor's degree in nursing and then to enter the field as an RN. After that, I also want to clarify that a number of you in this room may be thinking about pursuing nursing elsewhere outside of San Jose State, and that's okay too. So your two options at that time would be to look into associate degrees in nursing, oftentimes held at a 2-year college. Then you can go ahead and graduate, pass the NCLEX, work as an RN. You can also then at that point come back to San Jose State and transition your RN into a BSN. We do have an RN to BSN bridge at San Jose State. The other option, going back to the top, if you're going to pursue nursing elsewhere, would be to transfer to another school that has a Bachelor in Science in Nursing program. Now keep in mind that whether you're looking into associate's degree or bachelor's in science degrees, they are just as competitive, if not more, at other universities. So it's really important your grades are extremely high and that you're taking a really close look at the admissions statistics at the schools that you're considering. All right, so a moment ago, I referred to Accelerated Bachelor's in Science in Nursing programs. And this is one that I find a lot of our students don't know about. So these programs really target students who have gone on and already completed a bachelor's degree with something other than nurses. However, they still are dedicated to the practice and want to become nurses. Remember that you can do a 2-year program oftentimes at a community college and become an RN, but as the field of nursing changes and the expectations get higher, that many hospitals are really targeting students with bachelor's in nursing. So an accelerated bachelor's in science and nursing, I'm going to give you one example today. These programs, if you look them up, oftentimes are about 11 to 18 months, which is very different than the 4-year degree that you've already completed. The typical prerequisites are probably pretty similar to what you've already looked into through taking at San Jose State. However, the cost can be quite high. Now, keep in mind, I've given you information today on the program at Samuel Merritt. Samuel Merritt is a private university. Private universities are always more expensive, but the reason I shared Samuel Merritt is it really is the only accelerated bachelor's in science and nursing program that's accredited in this Bay Area. There are other programs that are not connected with private universities that would probably be a lot cheaper. However, you would have to probably move out of the area. So if you were to go to Samuel Merritt, you are looking at about a 3-semester program, and the cost can be right around $83,000. Now, there may be financial aid available, but as you can see, this is a huge financial commitment that you would need to be ready to make. All right, so in this slide, we're going to be talking about alternative majors available at San Jose State for those of you who decide to stay here. There are a number of different majors available, and the ones on this list are just a few of them. These are common majors that many students who start out as undeclared pre-nursing end up decide to pursue here at San Jose State. So social work, public health, recreational therapy, psychology, communicative disorders and science, child development, kinesiology, nutrition, and so many more. All of these are really directly tied to a lot of the values and interests that really bring a lot of people to nursing in the first place. So I really want to encourage you to go onto the department websites, look at the requirements, review the required courses, and look at careers that are connected with these fields. And you may find that you will really succeed in these majors and go on to a really amazing and fulfilling career. So this slide looks at California salaries associated with alternative majors and degrees, often connected or similar to nursing. This is just a very small sample size, but hopefully it'll give you some ideas. I've organized it by the amount of degree it takes to get these jobs. The first two, respiratory therapists and occupational therapists, usually can get these type of degrees through going to a 2-year associate's program. The next two are the health educator and the recreational therapist. These are jobs you can get after completing a bachelor's degree. We actually have majors at San Jose State, public health and recreational therapy that will direct you right into this path. And the bottom two, speech therapist and medical social worker, are both careers that you need to have a master's degree completed in order to get them. Now, what's important is not to just be fooled with a high starting salary, because each field, basically the certifications to get into the field can change, the amount of job growth and how many jobs are available can change based on how much education or how little education that you have. So it's really important you just do really, really thorough research in this field to understand if there's going to be a lot of job growth, an opportunity, and if you are the kind of person who wants to move up, maybe take on more responsibility, management, or make more money, make sure that your level of degree matches that. So one thing that's really important as we talk about alternative majors specifically here at San Jose State is that you do need to go in with your eyes wide open. There are a number of majors very related to nursing here at San Jose State, including kinesiology, social work, psychology, and public health that are currently impacted. So you want to work closely with your academic advisor to better understand what the impaction criteria is in order to get into those majors at San Jose State and what that might mean for how long it will take you to graduate. There are a lot of alternative majors that are very similar that you'll see over here on the right that are not not currently impacted, so you're going to want to consider those as well. But the important thing is you can look up this impaction criteria through talking to an academic advisor. You can also find the information on the department homepage and really make some good decisions in educating yourself as far as what is the best path for you.
My name is Mary Carson. I am a recreation therapist at the National Institutes of Health. Recreation therapy uses recreation and leisure activities as a way of achieving goals for patients. It could be a functional goal, physical, emotional, social. It could be a psychological goal, and it ultimately is to improve their quality of life. Many of the recreation therapists here work with people with very rare diseases that can cause a variety of issues. We have a lot of cancer patients, we have pediatric patients, so we're providing that recreational intervention within the room or even within group activities that we provide throughout the hospital. It's very individualized based on the needs of that patient. The Wii is a great intervention because it can be adapted for so many different skill levels. Anybody who's used it before can tell you, you can sit down to play, you can stand up. We also will use it if we're working on balance with somebody, say they've had a stroke and they're having trouble with their balance. We can use it as a way of practicing that balance and get it stronger. I get to play for a living. Even though it's work and I have to be watching for things and measuring things and writing down what the patient's doing and keeping track of it all, in the long run, I'm doing recreational activities as a job. It's pretty cool. With a recreation therapist, there is no such thing as a typical work day. I work varied hours. Each day, I have to keep in mind what time am I coming in, what time am I leaving, so it's fun. I would definitely recommend a career in recreation therapy. You can get up to your doctorate in it. And it's always fun. There's always room to grow, so you get that great basic training in a bachelor's, and you can grow from there.
I knew I wanted to do something in the medical field. I knew I wanted to help people and be in that environment. Doctors and nurses are there to fix things after the child is sick and make them better. As public health educators, we're there to help stop those health things before they even start.
My sophomore year, I took one class, and I loved it.
I had my first classes and was talking to the professors. I just knew it was perfect for me. It was exactly what I wanted.
Public health is huge, and there are so many different areas that you can get into.
I work as a prevention educator for Safe Connections. I go into schools in the St. Louis area, St. Louis City, and I talk to kids 6th through 12th grade about relationships.
I work at St. Louis Children's Hospital. I'm a community health educator. I deal with car seat safety, bicycle and helmet safety, and home safety.
I am the executive director of the St. Louis Downtown Neighborhood Association. It's a community organizing job at its core.
I'm currently serving in Albania with the Peace Corps as a health extension volunteer.
I do teaching within the school with the med students, and I teach them about community outreach. And then the other piece is actually doing the community outreach with the students or teaching the students to go out and do that.
The most important thing that you can do when you're trying to make any big decision in your life, including what degree to get or what career to go into, is to talk to people and just get some exposure. So this slide is all about just kind of opening your eyes as to different types of volunteering that you can get involved in. These are just 3 hospitals that are local to San Jose State that have a number of different volunteer opportunities, and there's a number of others as well. Also, we've learned that a lot of people going through the undeclared pre-nursing program are working their way through school and do need to work in order to pay their bills. I want you guys to understand that there's actually a lot of entry-level paid roles that you can get out in the community that are going to give you face-to-face exposure to working with clients. So including some of these roles are called caregiver roles, Also seen students get into medical front or back office work roles. It allows them to get really exposure of working in a medical setting, working with patients, working with doctors, nurses, and really ultimately just building their resume and making some decisions as far as what environments they like and what populations they really want to work with. So prior to attending the UPN workshop, it was a requirement for you to take the online Focus 2. This is an assessment that looks at your interests and your values, not your skills, and it looks at your results and helps you determine what types of majors and also career paths that you could follow that would be in line with those results. So in the next few minutes, we'll be looking a little bit more about what you can do to continue your research on Focus 2, which is available anytime through a link on the Career Center website. So I think the easiest way to dive into these results is to go ahead and select Combine Assessments, and that will help you look specifically at the majors and careers that matched in your work interests and your personality assessments. So you can click on the left to click on the job title and learn more about what each job does. In the center column, you'll see each of the majors specifically at San Jose State University that are often connected with that job title. And the great thing to do as you start finding job titles as well as majors that interest you is you will have the opportunity to push the Save button at the bottom of each page. And this is a great way to be able to look back and review your data as well as to bring in results if you were to meet with a career counselor or even with a friend to be able to share the saved common job titles and majors. So there are a number of different things that you can do after today's workshop to kind of keep the learning going and keep the exploration going. You can always log in to utilize your Focus 2 results and share them with others, and you can do that through going through the Career Center page. If you go through the Career Center page, you'll see there's a number of career-related events that happen every month that you are welcome to attend. On the major selection side, we always encourage you to work closely with an advisor and do your own research as well on major coursework, and that all can be done on the department websites. Definitely seek guidance from mentors, favorite instructors, friends, and family that know you really well. And if you'd like to sit down with a career counselor, you can do that through SJSU Handshake to schedule a 30-minute meeting to talk about any of these things, including exploration of majors, what you might be able to do with that major, and making sure the major is going to be a good fit for you. So that is about it. Like I said, please do consult your academic advisor for any kind of academic assistance, and we'll move on to making sure you know who your career counselors at San Jose State are. So any of the career counselors at the San Jose State Career Center can help you out in your exploration process. But if you'd like to speak with one who specifically is an expert in your area of interest, you can definitely do so. Again, this is Kristen, and I specialize in health-related careers. My coworker Christine is very focused on education, public service, social work, and you can also sit down with both Larissa or Nellie, who really focus on working with students who are really trying to explore all the majors at San Jose State. The Career Center is located in the administration building, which is right next to the engineering building. You can reach out to us anytime on our website, sjsu.edu/career center. And we look forward to supporting you through your decision-making process.